is it fair to go to countries like India? India might be a bad example because they have got quite a good economy, OK? I know there's massive poverty in India, but in the grand scheme of things, India's economy is pretty good, right? But other countries, other less economically developed countries, is it right that we are so welcoming to some of their top brass in terms of their medical profession? Would they not be better served in their own country? Are we brain draining the world, is what I'm getting at?
Well, I think it's a difficult question because they wouldn't come if they didn't want to come. So there is something that's drawing them to come and work in the NHS. And as for our own NHS, I think the reason that people are so drained and so exhausted, and this is true of the social care sector as well, is because we don't have the workforce and we've not invested in making sure that we can keep the doctors. We've been very, very, very driven by management. Managing the NHS has been the big thing. I think that's made it very difficult.
Yeah, just quickly, actually, very quickly, sorry, but I just want to put to you something one of my producers actually mentioned earlier, which is when we do bring people over, let's say we get, I'm just picking a number out of the sky, let's say we get 10,000 people from India, OK? We have to then find them somewhere to live, we have to maybe do some additional training, etc. And there is that added burden to it as well. And presumably, as you've just said, Nadra, it would really be the best thing for everyone all round if we could get people who were already here, because then we wouldn't have to find additional accommodation for them all.
Absolutely. I don't think it's a burden. I think it's a responsibility. If you bring people across, then you are going to have to look after them, give them the pastoral care, make sure that they have that sort of cultural grounding of the difference in the work. Okay. Absolutely. But I will stick by my point, which is that we have to invest in a domestic workforce, and that's by improving the image and the pay of the people who are doing the job.
Yeah, the image, well, the pay, of course, is important. The image, especially at the moment, is absolutely through the floor. Nadra, thank you very much. Nadra Ahmed MBE there, who's the Executive Chair of the National Care Association. What do you make of that? Ladies and gentlemen, we obviously need to fill vacancies, don't we? Is that the right way to go about it? GBNews contacted Health Education England, and they said to us, we continue to work on developing relationships in India for doctors, nurses and other health professionals as part of our mandate to support the growth of the NHS workforce. The purpose is to support a new ethical pathway for international healthcare staff to come into the West Yorkshire area and to help increase staff numbers.